everyone, welcome to the fourth episode of the Hey Girl Show. My name is Faith Panache. First of all, we want to thank you for the response and the support you guys have been showing us. Our first episode on yeast infection, the response was overwhelming, and it was so fun and exciting to see that it was a topic that we all related to as women, and it's a subject that we have all gone through at some point. So as the Hey Girl Show team, we decided why not bring in a professional and have it explained to us in a scientific way. What exactly is a yeast infection? So in the studio today, I have Dr. Kufa, who has come through to talk to us about the yeast infection. Welcome, Dr. Kufa.
Thank you.
Thank you for coming to explain this to us today. Our first episode, as I've said when I was introducing, was on yeast infection, and the response was overwhelming. We had a lot of girls, a lot of women coming through and commenting about yeast infection being a nightmare. So maybe just to begin with, can you explain to us what is vaginal yeast infection?
Okay. So vaginal yeast infection is an infection which is caused by a fungus called Candida albicans. So this fungus it affects the vaginal area, and so usually what happens is there are risk factors that predisposes a person to this infection. So if you are taking maybe antibiotics, if you've got diabetes and the diabetes is poorly controlled, or if you have what we call immunosuppression, so things like HIV, or you're on cancer treatment. So these conditions can put you at risk for developing yeast infection. So when you're taking, when I mentioned sometimes that you are taking antibiotics, the thing is the vagina has what we call normal bacteria in there. So if you're taking some antibiotics, they can actually disturb the balance of every soul, which allows for the yeast infection to grow.
Okay, so you've explained antibiotics as one of the causes. We have heard that maybe sometimes things like food, the food we eat, and you have to sun dry your underwear and things like that. Maybe can you explain a bit on that information?
Okay, so things like other things also that can put you at risk is like wearing underwear which is wet, which is damp, which didn't dry out nice, well, and also wearing tight fitting pants, wearing tight or using panty liners every day, then can also contribute to
causing vaginal thrush.
Yes.
Okay, so it's not recommended to use panty liners every day?
Yes, I think you can when it's necessary, but some ladies, because they're just used to putting panty liners every day, I think it's not necessary as well.
Okay. All right, so moving on, what are the signs of a yeast infection?
So usually this vaginal yeast infection, or what you call vaginal thrush, so usually you have itchiness around the vagina. You can also have discharge. Usually the discharge is looks like milk, or some say cottage cheese or sour milk, so usually whitish, and it's odorless.
Okay.
Usually. Yes. So those are the main symptoms. Sometimes you might have a clear discharge with itchiness.
Okay, so when it's vaginal thrush, the discharge is odorless. What if it's a situation where it has a smell? Is it still vaginal thrush? Is there something else involved with the vaginal thrush?
Okay, like I said, usually the discharge has a peculiar looks like milk, like a sour milk. So sometimes if you have another type of discharge, maybe a white discharge or creamish discharge, foul smelling, then it could be some other, because there are other things that causes vaginal discharge. So probably you need to then get seen and see what exactly is the cause.
Okay, and does vaginal thrush recur? Like once maybe you've had it and you've been treated, does it come back?
Yes, it can come back. Like I've said, some women actually, when they actually don't know, and they're wearing these tight-fitting pants, recurrent. So sometimes you can get it, it clears, you can get it again.
Is it sexually transmitted? I'm sure we've had so many cases where, or actually maybe from the comments that came through from our first episode, a lot of girls were saying they were confused at first. They thought it was an STI because of the itchiness, the burning, and the discharge. And you know, when you tell your parents at first or friends, the first thing that comes to mind is, who told you it's thrush? It could be an STI. So maybe people would want to know, is it sexually transmitted? Can it be sexually transmitted?
Vaginal thrush is not part of sexually transmitted infection, but sometimes men can have also a thrush, but a fungal infection, but they would have gotten it from their partner. But we don't say it's not a sexually transmitted infection.
Okay, so it's not related to an STI at all.
It's not a sexually transmitted infection.
So you hear that it's different. Okay, and then you actually did mention that men can get yeast infections or thrush. Is it thrush only, or there are other infections that men can get that are similar or related to vaginal thrush?
Like I said, men can also get like infection, like a fungal infection also on their genitalia. But I'm saying we do not categorize vaginal thrush as a sexually transmitted infection, because even people who are not sexually active, girls who haven't slept with anyone, they can get the fungal infection. So it's not a sexually transmitted infection.
Okay, so now moving on to the other exciting part of this topic, the treatment. There are so many ways that we have heard or have been taught on how to treat yeast infections. How can one treat a yeast infection?
So usually this vaginal yeast infection, vaginal thrush, it can be treated by what we call antifungal creams. So usually you get them prescribed and buy it at the pharmacy, so you can apply for the antifungal cream, and mostly usually it clears. But sometimes if a person is getting recurrent infections, you might then get maybe a tablet or antifungal tablet, which you can be prescribed by a doctor.
By a doctor.
Yes. And then there are other ways. People say home remedies.
That was going to be my next question on the home remedies.
But okay, honestly, I've had people say you can use yogurt. Some can say
plain yogurt,
or natural yogurt, or garlic. Those things really I haven't seen anywhere where they say it has been scientifically proven that it works. But some people say for your natural yogurt, yes, but garlic, no, I haven't seen it. But it's not yet scientifically proven that it really.
I don't know if maybe
works.
My next question, I'm going to be putting you in a corner. I hope it doesn't feel like it, but when it comes to garlic, not only has it been recommended to use for yeast infections, but maybe cleansing and a whole lot of other things. And people strongly recommend using garlic and ginger. What side effects maybe can possibly come from using garlic?
Okay, sorry, before I answer your question, I just want you to clarify where you said cleansing is cleansing where? Exactly.
Cleansing of the vagina.
So, or putting it inside.
Putting it inside, yes.
So usually we don't recommend putting things inside. Usually because the vagina, I know people say we want it clean, but vagina is a place where it self-cleans
itself.
Exactly. It cleans itself naturally with the environment, so you have to wash outside. Because also, like when I say some of the risk factors, like I saying, is also what we call dotching, by putting water, soap inside and
so you can't put water inside?
And soap because some women say because we want it to be clean, so they put things up there like water and then put their hands up there trying to clean. No, you just clean the outside. Inside, it cleans itself. So it usually, so most people will say, no, we want to smell good, but it's not recommended to put things inside your vagina.
Okay.
All
right.
So usually you just clean outside with water.
All right, so maybe do things like feminine wash, gynegot come into play as well? Because these are things women are using to try and make sure their little girl is as clean as possible.
Yes, I think the thing is, like I was saying, it's not recommended for you to put things inside. Things, because you then disturb the environment, which is natural in there. So usually I know most people say, it smells. But I'm sure if you really wash outside, you will be clean. So it's not recommended usually to use those dodging, putting things inside and simple. Just wash outside. It cleans itself.
Okay, so maybe considering that sometimes, well, maybe for example, the way it happened to me, my yeast infection experience, I didn't know I had vaginal thrush, and I stayed for like 2 weeks, scratching and burning for 2 weeks, and then I figured out that this is not right. Something is not right. I then went to the doctor, and I was given the pills you.
Okay.
Yes. So maybe, at what stage should one see a doctor when it comes to vaginal thrush?
I think as soon as you see the symptoms, and like you said, some people actually don't know what's going on. So if you see a discharge that you're not sure about, you just go and consult your doctor and then get clarity what it is. Because like you said, most people think it's
an STI.
It's an STI. But now that you know that the symptoms, you can say, okay, so usually if she has itchiness, a whitish discharge, you can then go get treatment. Yeah, but usually go as soon as you see symptoms and you're not sure what it is, then seek medical advice with your doctor.
All right, Dr. Kufa, maybe before we wrap up, would you have anything you'd want to add, anything you'd want to say in line with vaginal thrush, what you feel maybe young girls should know?
So, the people should just know, how to take care of themselves. Like I was saying, not wearing tight-fitting pants, drying your underwear properly, maybe cotton underwear is better, and also the dodging and then cleaning your vagina. I know most people want to put soap in the air, all sorts of things to make it smell nice, but the environment, it usually cleans itself. So usually clean the outside, not put soap inside to try to clean, because those are some of the things that, so even with these natural remedies, I think if you do that, taking care of yourself, wearing, like I was saying, not wearing tight-fitting pants, you getting it, you won't have it recurring as much.
All right, thank you, Dr. Kufa, for coming through and making this as simple as possible for us. You've heard it, ladies. Use clean water only, and you should sun dry your panties to make sure maybe you try and avoid getting a vaginal thrush. So guys, thank you for following us. Please continue following us on Twitter, Facebook, and Instagram, Hey Girl, and subscribe. Don't forget to subscribe to our YouTube channel. So let's keep talking.